Shafero, who said good family. It's been forever, but welcome back to yet another one episode. It's Mind, Body, and Legal Matters. I've even lost count, I will say that. But we talk, or at least we cover lifestyle, wellness, and everything that keeps you looking and feeling your absolute best. Now, today, we're diving into a topic that affects all of us. And when I say all of us, I mean the entire human race, literally. Yes, even the ones hiding under the hats. It's hair and scalp health. Going to be covering that today. And listen, we're not doing this one alone. We never do it alone. We always have some experts that come through. And today we brought out the big guns. I don't think you're ready for this one. I don't think any of us was ready for this one. I might just reveal a secret of what actually happened leading to us getting to this point. I might just, because we're all about transparency, no?
Yeah.
We're all about transparency, and I'm going to say it. So keep it locked and not change. Just stick around. I'll tell you what happened. You know, it's a miracle that we're here today. And we absolutely thank Dr. Lebu. But yeah, she's the one that's joining us in studio today, a certified trichologist, a real life hair and scalp, I like to say detective. She's here to unpack why your hairline might be taking slow steps backwards, or why your wig glue is fighting for its life, and maybe your scalp that has been trying to tell you this whole time. So get comfortable, grab some tea, grab your wine glass, whatever you wish to do, and prepare to learn, to laugh, and maybe rethink your hair routine. Let's get into it. Lumkile, how's it?
Hi, Bonso. Good day, everyone.
Eish.
It's been long. It's our second episode with Dr. Levu. You didn't see the first one.
But you're not
You didn't see the first one because we lost it.
Well, the cat is out the bag.
Welcome back, Dr. Levu.
Thank you so much.
Yeah,
Good to be back, I must say.
So what had happened was, and this is the secret that I was planning to keep at least until towards the end of the show. Thanks a lot, Lumkile. We actually recorded at first, but unfortunately, we lost the footage.
Yeah.
Literally, we lost the entire thing. And so with that being said, we do apologize because I know for sure you've been waiting for our next drop, and we delayed not just by some weeks, Nyana, like we actually delayed. We're quite distressed because it was an amazing shoot. But we still have the queen, the expert herself, again, the detective of all things aesthetics and hair and scalp. And I'm just glad that you gave us a second chance, and we absolutely appreciate you. How are you doing today?
I'm doing good. How have you been? I see you are well. There's no flu, nothing.
Oh, so the last time
you had a flu.
Your voice is this clear.
Yes,
normally.
This is how I sound.
Perfect.
Yeah, the last time I was a bit sick. But before we even get into anything, I want us to get into some icebreaker questions with Dr. Lebu. So before we get into just the nitty-gritties, what's the worst hair mistake you've ever made?
Myself personally.
Yeah. Or maybe even with your...
braiding my baby hair. That's a sin.
Oh my
trichology. So if they're doing your hair at the hair salon and they touch your baby hair, that's a total no. From a trichologist point of view, those are the worst hair to even touch.
Yeah.
Because those are poorly developed hair. So they don't develop at the same pace and stage as the rest of the hair. They don't complete the full developmental stage.
I see.
So they are quite thin, they are quite fragile, they are easy to break. And because of the way the lifespan of the baby hair is, they reach a certain point where they do not come up anymore. So if you keep yanking them from the root, at some point, the follicles at the base will fall off or will die, literally, or involute. And then there won't be any hair coming up. This is how people lose their hairline.
Yeah.
So
by the way,
for me, that is the worst thing, because I've done it once or twice and I realized, it took me a few months for this baby hair to grow. So basically, it's something that even if I go and have even now I've got braided hair.
Yeah.
My baby hair is lying down with the gel. I will never allow them to touch that area. So I'm teaching that to everyone that I know. My girls, when they go out, I tell them not to touch your baby hair.
Yeah.
And they already know. The minute they get to the salon, they will ask for a frizz gel immediately and say, just do the baby hair, frizz it, put it down.
Just so you don't make a mistake of touching.
You will touch the rest of the hair. So for me, That was it.
Got you. If your scalp could talk, what would it complain about the most? And be honest with us.
I think for me, I keep natural hair. Normal, my hair is afro.
Yeah.
So I don't fiddle much with it, but I change the hairstyle a lot. Even if it's afro, I do your Betty and Benny. I do my cornrows on the sides. I think if it could complain, it would be the fact that I don't give it rest.
Oh.
Even if it's natural hair. And that really does irritate the scalp, because at some point, the scalp becomes very sensitive. You feel like it is in pain. Even if it's not really like being pulled and braided and stuff, the hair needs to rest.
Sure.
It needs to a timeout of some sort. You can't keep changing hairstyle from one to the other. At some point, you give it some time for the hair follicles to regenerate.
Got you.
So at some point, the scalp became a bit painful, became a bit, inflamed. And that's where I learned, once in a while, let the hair grow. Do not do any chemical treatments. Just wash your hair naturally with soap or shampoo. Put hair oil there, comb your hair, let it be.
Allow it to be. One hair trend you wish would disappear forever.
One?
Hair trend.
It's definitely braids. I would say between braids and dreadlocks.
Ooh.
Those two are the biggest culprits. Dreadlocks even more than the braids. Because remember, dreadlocks, people don't get a break.
Yeah.
They have that hairstyle for years and years and years. And recently, because of the styling that's being done now, like very advanced styling that the people at the hair salon do, they will twist, they will turn, they will manipulate, and every time you do that, you are literally pulling the hair out from its roots.
Because I was about to say, and sorry for interjecting, I know of people that have locks, at least from the olden generations. Isn't my 2K? Askies. But their locks are so healthy, and you can literally still see their natural afro hair underneath, and they don't twist them as much, and they grow as long as to the knee.
Yeah. There's nothing wrong with either of those two. There's something wrong with pressure that you put on the hair follicle.
Sure.
We don't say do not braid your hair. We don't say do not do dreads. We're saying your styling of that is the problem.
Yeah.
So pressure or tension that you put on the hair follicle is the main problem.
Got you.
The minute you pull the hair for long periods of time, it's okay to braid your hair now and take it out in 2 to 3 weeks. But if you're going to take it out in 2 to 3 weeks and do another braiding, and then the way you style it, when you style it, you pull it back or you pull it up. When you tie it too tight. Those are the only problems that we experience when it comes to hairline loss. Look, our people used to braid their hair for many years back. They used to do dreads. Our mothers had dreads.
So true.
But they never lost their hairline. It's because they would literally leave there. If you remember our moms, our aunts, they used to leave their dreads just flowing down their backs. They never used to tie. They never used to lock them. They never used to twist them or anything like that. And that preserves the hair quality. It preserves your hairline. But now it's the styling that is the problem. It's too advanced. It's too pulley. And the pressure that is on the hairline is just too much.
Okay. Before I allow you, Mr. Lumkile Mkhosana, the host with the most, to take over, just one simple question, yet absolutely important, because I know there's a lot of us that want to be a Dr. Lebu or are really interested in who you are and what you do and all of that. Just briefly, who is Dr. Lebu?
Right, so Dr. Lebu is just a girl from Venda. Grew up in Thohoyandou. That's where I was born and bred. I'm a medical doctor. This is my 21st year of practice.
Ooh.
Yeah, I'm not
Been
as
around,
young
eh?
as you see.
And you look
I
very
just
young.
don't age. All right, I've got good genes. And
Period.
all. So I qualified in the University of Natal, 2002. So when I say 21st year, it's quite a long time ago. So I am currently run my own practice. I'm a trichologist by profession. And also in aesthetics. Recently qualified and graduated in advanced diploma in aesthetic, cum laude, Thank you.
Period.
Yes,
And it's not
I'm a
easy.
learned hand. Okay.
You literally are.
Yeah, so I actually have 3 diplomas. For those who don't know, I've got a degree, which is the MBCHP, which is Bachelor of Medicine, Bachelor of Science from the University of Natal. I have a diploma in ophthalmology. Ophthalmology is the treatment and taking care of eyes. So I can operate your eye, believe it or not. Yes, I can put a cataract.
Oh my goodness.
In
Whatever that is.
Remove a cataract and put a lens, basically.
Sure.
So I have a diploma in that, and then also I am a trichologist. That means I'm trained in hair transplant. I'm trained in hair treatments and scalp health. So that is me. So currently I run a practice in Centurion. That's where we are based, our main clinic. But we've got 2 branches, one in Venda in Toando and the other one in Polokwane. Yeah.
Amazing.
Okay. Thank you, Bonsi.
Now you can. Now you can go.
I was a bit worried about you going along with the questions. That's why I had to.
Taking over.
Yeah,
I got too excited.
That's
Sorry.
why I was saying I had to tell the viewers that it's our second episode.
Exactly.
Because of familiarity. People are looking at us and they're like, but did you tell us who is this? You know, because we already know.
We already
from
know who Dr. Lebu is.
our
That's true, yeah.
our lost archives.
So traumatic. So traumatic.
So yeah. And Dr. Lebu, how's your day like?
Phew, that's a good question.
A day in the life of Dr.
Yeah,
Lebu.
I have a long day. Look, I'm a very active person. A day starts with dropping the kids at school. After I drop the kids at school, I hit the gym. Okay? I'm a gym fanatic. I am a strong believer in keeping fit. Not just because of health reasons, but also because I'm an aesthetic practitioner. I deal with health and beauty. That's my bread and butter.
You are living in
proof.
Billboard.
If I say lose weight, tone up, get your skin in check, I must also do the same thing. Get a hairline. Mine must be intact as well. So I can't preach what I don't practice.
Do as I do.
Yeah. So after I go to the gym, I go straight to work. I run a very busy clinic, especially the aesthetic skin. So that literally takes half of my day. And I do everything from skin treatments to hair transplants to weight loss treatment. A hair transplant, by the way, takes the whole day. Literally 12 hours straight of doing. It's a serious procedure.
I don't know if I have 12 hours, but
I think you will need 24 hours.
But you need
for
24 hours.
because, and that's the thing with male pattern baldness. It's worse than the
yeah.
It needs more hair.
And what's the most common condition that you see in the clinic?
Definitely the male type baldness, because that's natural or physiological. So literally 50% of men will go.
What causes it?
It's caused by what we call the DHT, which is literally a transformation of testosterone into DHT. DHT, unfortunately, is the one thing that attacks the roots of the hair. So it attacks the follicle bulb and making it not to grow. Unfortunately, it's something that cannot be prevented, first of all. You cannot prevent it because if you're a male, you have testosterone. That's why you're a male, right?
Yeah.
And then as you grow or as you grow older, it gets activated for some reason that we don't really understand. If we understood that, we'll know how to block it.
We'll know how to reverse it.
So far we don't. We will treat it as and when it comes by blocking it with some other things, but only because we want to improve the hair, not because we want to prevent it from starting. So if you develop male pattern baldness, what we call androgenic alopecia, we already know that you have high DHT. There's a way that we need to either treat it or to prevent it from getting worse. We cannot stop it completely, right? So things like hair transplant will help in the immediate state to at least make you have hair. But if we don't block the DHT, you will lose that hair eventually. Because the process is an ongoing one.
Yeah,
if you're not going to block the DHT, even if we transplant your hair,
But
it will grow for a few months.
But are
and
there
then it
other
will go
side
again.
effects of my DHT being blocked?
Not specifically on the head. There are other problems with blocking DHT in terms of your sexual health. Yes. Especially if we are going to block it orally or if we give you tablets. If we prescribe you tablets that blocks DHT, obviously they're tampering with testosterone.
Yeah.
And that's where a male sexual health comes from.
Will I end up with curves?
No, you might end up with low sex drive. You might end up with impotence. You might end up with low performance sexually. And that's a big deal.
It
For
is.
a male, it's a big deal for families.
Yeah.
You don't want to break families apart and stuff like that. So we avoid those kind of prescriptions, especially for young people. If I see a patient that is young and already developing androgenic alopecia, I'm not going to put that patient on a DHT suppressant because that's a young patient. I mean, a young person. So we prefer blocking it locally. So that's where we will prescribe things that you can apply directly to the hair to block the DHT. Because the DHT is activated or is acting directly on the follicle. We might as well put the blocker directly on the follicle.
Because now you've just scared all men who are watching.
And these are serious side effects that we need to tell you. If you choose to go that route, at least we should be able to warn you. To say, look, it works perfectly. Your hair
You're going to have a long hair.
Your hair will be perfect.
And nothing else.
But you will be crying about other things. So that is it. So we usually will prescribe a local acting thing, a mousse, a spray, a serum, which we know that it's got a DHT as a present. And that's how we manage.
And other types of alopecia that you see except us?
So the most common one will be the traction alopecia. That is the one we see mostly in our females and mostly our black sisters because of how we style our hair. With the new craze of braiding your hair, unfortunately, a lot of people want hair that is perfectly braided.
That's true.
Right?
Yeah.
So if you want perfectly braided hair, it means you don't want to see any hair left out.
For sure.
So we go and braid even our baby hair, which is an absolute no when it comes to trichology. You never touch the baby.
I got lost a little bit when we talked about baby hair. Because you said your baby hair and you're talking about now.
Yeah.
Like I thought maybe by
So,
baby hair
yeah.
it's
As a
supposed to be
child.
something
So
that...
the reason why we say it's baby hair is because it is exactly the same texture as a baby's hair. It's thin,
Very
it's
thin and
fragile,
soft.
and it's
But
very...
is it the front one?
It is only in the front. That's where your hair is going to be. So hair is divided into three zones. You've got the baby hair, you've got the transformation zone where it's transforming from baby to the thick coarse hair. And then the thick coarse hair is zone 3. So it's 1, 2, 3. You never braid zone 1 at all. You never touch zone 1. Even when you're doing your twist or your locks, you avoid zone 1. Style it. These days they are advanced and nice styling of the baby. Rather do that and not touch. So traction alopecia has become an epidemic, unfortunately now. Almost everybody has some complaint of hair loss.
Do you think maybe there should be a course about this when people are doing... What do you call them? People who are doing hair?
Braiders.
The hairdressers,
Yeah.
Absolutely. It's unfortunate that it's an industry that is unregulated.
That's so
Yeah.
true.
So you cannot really spot people that are doing the right thing and people that are not doing the right thing.
But the issue there might be that the client wants it neat.
Yes.
So even if the hairdresser knows that is wrong, but last time she left a little bit of baby hair and you complain, you said she didn't do it well.
But I
so
think
now she's trying to please you.
Yeah, but it's because people are not being told why.
Yeah.
If you don't explain the reason for doing something, those people are less likely to agree to what you are suggesting. But if you explain your reasons, especially scientifically, people are likely to listen and you give them examples, you show them pictures. And I'm sure there's someone who knows someone in their circles or in their family who've lost hair completely, strictly from braiding.
Yeah.
And then they've got traction alopecia. And unfortunately, traction alopecia, if it continues untreated, it turns into scarring alopecia, which is the one where the hair shines almost like bold.
Oh, yes.
It becomes scarred because the more you traumatize the scalp, the more it becomes scarred over and over and over again. So continuous trauma to the same place will eventually lead to scarring. Once you get to the stage of scarring alopecia, what we call cicatricial alopecia, there's no return, there's no turn back. Unfortunately, that's an untreatable form of alopecia. It will take you years and years to try, to get back to your normal
So
scalp,
this
but
podcast should help people in terms of understanding what is expected.
Yes. Where you should get the hairdressers is when they are at training, like somatology classes or somatology schools where they train hairdressers. But that's just a few people that really go for formal training. The rest is being trained on YouTube.
And also, I just feel
like my neighbor and my sister.
I think it's gonna be a bit stigmatized in that, not necessarily stigmatized, but I think people are gonna assume then they're gonna be mad expensive. Like if you went to a school of, learning how to take care of one's hair while braiding it or while making a person look nice and all of that. But also just alluding to what you're saying, Dr. Lebu, it's important. I think what's lacking here is education.
Right.
I think with experience, a lot of these hairdressers know exactly what happens when they touch the baby hair. They know exactly what happens. But because, we were like, I saw a celebrity so-and-so. The line started here by the eyebrow. Yeah. If you don't start it there, then, but they just want some cash.
They want and also because there's so much competition, people will just tell you, okay, I'll go somewhere else then.
Exactly.
And remember with the hairdressers, that's business for them. That's food on their table. As much as they are obliged to do the right thing, but they also out there, working.
For sure.
Getting food for their families. So I think it's important to at least teach, and it's important for the hairdressers to give advice to these people. It's up to you to take the advice. If you say, it's fine for me, just braid it, that's okay. But hopefully there are people who would listen to the advice and say, oh, okay, it's fine, then leave the baby hair. And if we start somewhere, we will always have to start somewhere with this education. It will catch on. As much as possible.
Yes, maybe there should be structured courses that we then advertised, and maybe one salon sent one person that's going to come back and teach others.
Yeah.
Even if it's just, skimming on top, because you can't get proper education with the 3 months course. But, it does make a difference.
It does something. But it also starts here. You can just, screen record this part. Send it to your aunt, send it to your sister, send it to your mom, so that later on, share it on TikTok as well.
Yeah.
So that later on you don't blame borakgadi ba ko Limpopo gore no bantoile aba ba tlo re ke be montle. Asi buloi, asi kesi, and maybe sometimes it's not even genetics. It's because truly you've just been doing things how you're not supposed to be doing them. Correct. Like how Dr. Lee was advising.
And Dr. Lee, do you want to tell us more about the transplant? How do you prepare for that?
So you never do a transplant without seeing a patient, just like any other procedure. Yeah. And it's not a guarantee that every patient that loses hair needs transplant. And it's not all alopecia that needs transplant. It's not all hair loss that qualifies for a transplant. Right? Yeah. So there are specific types of alopecia that do well with transplant, and others are a total contraindication. So in terms of groups of alopecia, traction alopecia is the most commonly transplanted because it doesn't have any underlying causes, right?
Oh, yes.
So there is no underlying medical condition. There is no underlying cause like what we see in androgenic alopecia. Yeah. There is no underlying chronic illness or some autoimmune disease like we see with CCCA, which is cicatricial alopecia, or frontal fibrosing alopecia, the one that you see a lot in our aunts, the one where they are just losing hair in the front, but it's so shiny.
Yeah.
There's hardly any hair. So that's what we call FFA. So traction alopecia, most commonly transplanted patients. After that is the androgenic alopecia, which is the male type of baldness, because we know they will gain so much from transplant and also from blocking the DHT locally. So the outcome is very good. So you always assess your patient. Very important to subtype what kind of alopecia is this patient suffering from. So you always categorize your patient. Is this traction alopecia? Is this cicatricial? Is this androgenic? Put your patient where the category is. From there, you assess how long has the patient been. What other treatments has the patient done before? There are patients with traction alopecia that is not so bad that you think, let me first try PRP treatment, or let me first try microneedling on this patient. Maybe this patient will do well. You'll find that this patient has done all that for a year already. Yeah. You can't now, if you don't ask those questions, you're not going to be able to. That is where history and examination of a patient is the cornerstone of every medical procedure.
So there are other procedures that might be done.
Correct.
Before we
Besides
do
transplant.
Yeah.
So I'll quickly go through that when I'm done with the transplant. So after you've assessed your patient and what other things that the patient has done, you need to find out the medical history of the patient. There are patients that are relatively contraindicated to do a transplant on. For example, diabetics. Oh, yeah. A diabetic patient, preferably who is not well controlled, would be unlikely to be a good patient. A patient that's got a bleeding disorder cannot be transplanted because we're going to drill your skull trying to get those hair follicles out. If you've got a bleeding disorder, you're going to give us problems controlling the bleeding, right? That's number two. Patients that are basically anemic and they are already on treatment, but they're not well controlled, so they've got a shortage of blood. There's a lot of blood loss during transplants. So we know. Anything that is not well controlled, if you're hypertensive and your blood pressure is high, I will cancel that transplant that morning, even if you're already being scheduled. Why? Because we're going to be injecting adrenaline on your scalp to, control the bleeding while we are busy. Adrenaline is going to push the heart rate up. Yeah. The heart rate is going to push the blood pressure up. You can lose a patient very easily on the bed with a simple heart attack just because the blood pressure shot up. A patient can get a stroke while doing a transplant. So some of these things are very serious, and I know a lot of people, because they think it's a cosmetic procedure, they don't think that.
Yeah, they don't think that.
You don't think you can actually
I might lose my life trying to get a follicle of hair.
So those are the kind of things. So you don't just say, this is traction. No, let me book you tomorrow. Come in. No, you must assess all that. You must do your blood tests. You must do all these other tests. Make sure the patient is absolutely healthy. You must know what the patient's medical history is. Is the patient on any medication whatsoever? Some patients that are on certain medication, if a patient is epileptic, you cannot transplant that patient. Yeah. You are likely to trigger a convulsion while you are injecting the patient's scalp. So after you've assessed all that and you are sure this is a patient that needs transplant, you book the patient. On the day of the transplant, you need to assess how much does this patient's grafts, how many are going to be. So it's a whole lot of calculation per square meter. We measure the head. We measure where the grafts are going to come from, which is what we call a donor area. So that's usually at the back of your head. Yeah. So if you've got alopecia in the front and you don't have hair at the back, that's a failed transplant already. Yeah. Because where are we going to get grafts from? Right?
Oh, yes.
So a lot of patients who've got traction alopecia, they think they are okay. Then you realize they actually have cicatricial alopecia at the back. Well. So they've got a combination. And it's very common.
Can you get hair somewhere else?
You can get hair on the chest, but if it's a female, where are you going to get?
It's chai.
Yeah, it's chai for you.
Yeah.
If it's a male, we can get hair here. We can get hair from your beard. But there's a lot of grafts that we need a lot of hair. I mean, you need sometimes you need like 1,008 grafts. The hair has more than enough. All the hair is healthy.
Yeah, no.
So after that, the entire procedure is quite long. It literally takes the whole day, almost 8 hours.
So will you say part of the preparation on the side of the patient is to manage first the diseases, whatever they have?
Absolutely. You need to be at your best health.
So you can't be skipping your hypertension medication.
No.
And then also booking other procedures on the side.
No, you can't. I am saying this practically so. There's a patient that I cancelled whose blood pressure was high. There's a patient that has cancelled who was bleeding excessively. And she didn't know she was a bleeding disorder patient until I sent her to do blood tests. And then they found out she does actually have a bleeding. She was just bleeding nonstop. We had injected the maximum dose of adrenaline, and the pulse was extremely high.
Sure.
We couldn't go beyond what
Beyond
that
what,
pulse was, because otherwise she would go into heart
Because
attack or something.
it's a tricky area, because alopecia also comes with age. But with age then comes other
with chronic
diseases.
illnesses, yeah.
Yeah,
Correct.
no.
So it's a big challenge. But if you select your patients very well, you shouldn't have a problem. The problem is wanting to do transplant regardless. That is where the problem is. You will definitely meet a problem somewhere. One day or the other, you're going to experience serious problems.
So other treatments that we can do beside transplant?
Obviously, from the simplest things is your hair serums. Hair serums are quite advanced. Things like minoxidil, I'm sure a lot of people know about it. A lot of people, by the time they come to me for treatment, they are already on minoxidil for years. So I know that people are using it out there. Minoxidil will work for you, but minoxidil will not make you have new hair. Minoxidil will only strengthen the hair you have. If you've got alopecia, you've got alopecia.
Because it was trended. I think it was the last year, minoxidil. Everyone was talking about minoxidil.
It was trending a lot on TikTok.
Yeah.
Because the other thing that was trending about it was that it was giving people facial hair as well. So a lot of
Yes.
people were complaining that, I'm on minoxidil, all of a sudden I've got hair
Everywhere.
on my lip, I've got hair, and in the beard area, I've got hair, above, and I've got huge lashes. Everybody was like, and my eyebrow has grown and stuff. Usually it's the way they use the minoxidil. Minoxidil will grow hair when it touches. So if you put your minoxidil on your hand, then you are touching your skin, you're touching your hair, your hair will grow there.
Just a question on that. There was a time where, since we're speaking about things that help hair grow, trending on social media, there was a time where a lot of people, now I'm just speaking for the Gen Zs, were eating dog food.
Yeah.
Apparently it helps
Bob
with hair growth.
Martens. Yeah.
Dr. Martens.
Does it really?
Yeah, well, scientifically, I wouldn't.
Yeah.
There's no scientific data.
And
Yeah.
do you know
back it up.
do you know it's an old trend?
Yeah.
It is.
It
man.
is possible.
I didn't know.
So,
It is
yeah.
possible that there's some kind of hair growing ingredients there, but it hasn't been scientifically proven. And that is medicine. It's not like we know everything.
Sure.
And we haven't proven everything. And there are things which are not documented or proven that people are using that are working, not only with hair growth, but with quite a lot of other stuff. Medicine is quite broad, and the human body is quite complicated. And there's a lot of traditional things that people have been using for years that have been working, even if the scientists haven't proven scientifically
But maybe we
to
should
say it works.
Maybe we should ask a vet for that.
Maybe
Because
we
maybe
should ask
maybe
a
it's
vet.
meant to make
Yeah.
the
The hair
dog.
of the dogs to be
Maybe this
healthy
is the
and
time where
fuzzy.
we merge
Yeah.
with Dr. Libu with
Maybe
with
you
the
must get
vet
a
to come
vet,
together.
a vet to ask.
But also it kind of highlights the extent in which people are willing to go in order to, grow
Yeah.
their hair and all of that. So
Remember,
prevention is better than
your
cure.
hair as a woman, especially as a woman, that's your crown.
Yeah, that's true.
You wear that. That's the first thing people will see besides your face when they look at you, and it boosts your confidence. It can also drop your confidence. So it's fundamental to your mental health, literally.
Yeah.
So the minute you start losing your hair, I can tell you from the patients that I've
Ish.
seen, it's quite devastating.
It does something to you.
Especially if it's a patient that you know very well that cannot be treated. I have a patient with FFA, which is frontal fibrosing alopecia,
Yeah.
that insisted on doing the transplant just because she was desperate. And the advice was that this cannot be transplanted because this is an autoimmune-based type of alopecia.
Gotcha.
So your body's immune system literally attacks your hair follicle. That's inborn. You are born with that. And if you watch that kind of thing, it runs in families. That kind of a person has an aunt somewhere with the same thing, has a sister somewhere with the same thing. So it's generational or genetic. So she was like, but I've tried everything. I've been on steroid injections. I've been on methotrexate. I've done PRP almost a year, and that's monthly, and that's a lot of money. I've done microneedling almost 6 months, but my hair doesn't grow at all. Can we try a transplant? And you have to counsel that kind of a patient because I know.
Shame, man.
That patient will grow hair for a month or two, and the hair will disappear.
Oh,
So I counsel the patient and say, this type of hair loss is difficult to treat. It's not curable.
Yeah.
I don't know of anything that will cure this. We can try the hair transplant, but I can assure you, in 3 months' time, you're going to come back and you're going to complain that the hair is gone.
It's gone.
Of which, indeed, we did the transplant, and it grew for a month or two or three. 4, 5, 6 months later, she started losing the hair, starting from the front to the back and this side at the back. But we have only transplanted the front, right?
Yeah.
Then it started getting lost from the left to the right. So it was thinning. And then 6, 7 months later, all the hair that we tried, healthy hair. She's got perfect hair at the back.
Yeah.
Perfect. It was not the quality of the hair that is the problem. It was not the transplant that is the problem. And she was just satisfied that she did see that the hair grew. So the transplant did work. But there's an underlying problem under the scalp. So it's important not to mislead patients.
Yeah.
I know it's a quite a costly procedure. You don't want patients to just spend for no reason. When you know very well that you're not going to benefit from that.
You know, talking about autoimmune, I've got a niece who's allergic to her own hair.
Yeah.
Is that common?
It's not common. It's like you being allergic to water. It's the same. There's people who are allergic to water. Every time they bath, they get a high.
Hey, Banna.
Yes, I have a younger brotber who grew up like that. Every time he bathes, he will just...
And I don't like bathing.
So, all allergic illnesses are very uncommon, except for eczema when it comes to skin and asthma.
But will allergy being allergic to your hair be termed also autoimmune?
It can be termed autoimmune, but it's a different type of classification. So there are things which we call IgE mediated illnesses, where you are inbornly allergic to something inside of you. So you're not necessarily injecting something or taking something that you're allergic to. You are naturally allergic to your own.
To your own, yeah.
So that's auto. Auto means yourself.
Yeah, yourself.
Inside, right? Yeah. So IgE mediated illnesses are
something we've seen
things.
first in neurological conditions.
Yeah.
It's for the first time I hear about it on
autoimmune. They are rare but very serious, and it can be frustrating to be allergic to your own hair. That means you must keep your hair short as much as possible. You cannot grow your hair longer.
But then, can you be allergic to your hair rather on the face?
Yeah, you can be allergic to your hair anyway.
Have you had to treat the face because someone came and consulted with the hair?
You mean in terms of allergy or
in just other conditions like maybe the skin conditions that are caused by hair braids or hair products?
And then it affects the face.
It affects the face.
Besides acne? No.
Oh.
You see, acne, sometimes it can be because of hair products, especially acne that is appearing in the forehead, just because of too much contact of the products to your skin, especially if you're someone that has oily skin already and someone that either have black hairs or white hairs, or you've got some kind of obstruction of the pores. So most times the hair products are quite heavy, right? Because they're going into the scalp, which is thick. They're quite heavy, they're quite oily. So the minute you apply them on the scalp and they are frequently touching your face, they might obstruct the
sometimes
small
they
pores
drape.
of
You
the
can
skin.
see an oil.
Sometimes they drape. So if you're something that is acne prone already, you are going to be having specifically frontal acne. So you'll find that you don't have acne anywhere else. Your acne is usually just here. That happens a lot with teenagers, especially in their 13, 14, 15, when now they are starting to braid your hair. Because before they were just happy with their afro, right? They didn't have a problem. So they didn't have to apply any heavy stuff on their hair. Yeah. But once they start going to high school, and now teenage years drives them crazy. So now they want new hairstyles and whatnot. Now they're doing their baby hair and whatnot. So you find that they've got a lot of pimples here. What in the old days we used to call them stage.
This
Yeah,
stage,
yeah.
but
Stage. Now they're getting pimples. Most of the time, it was just hygienic issues. It was just because there's a lot of hair products on the face.
now that we're there, I'd like to ask something very personal.
Yeah.
I don't have, is it eyebrows? I don't have eyebrows.
Yeah, brows.
I have no idea why. My hair grows very well.
Yeah.
For the first time ever, I went to, and I'm sure you guys saw me the last time, and I'm talking to our producer and Lumkile. We had a meeting, and I had lashes for the first. I'm becoming a girl because of people like Dr. Liu. So I got my lashes done.
Yeah.
And my lash tech was like, it's so interesting how you have long lashes, yet you don't have eyebrows.
Yeah.
And I went there to get a tint. And last time we came to record, I actually told you about microblading. We discussed this. So before, even checking out the route of microblading, I thought, let me go tint and see if having brows suit me because I've never had brows.
Yeah.
And it was cute. But I have lashes, healthy and long. I have hair, healthy and long. But I don't have brows. What is wrong with me?
There's nothing wrong with you. With that kind of a thing, it's purely genetic. Nothing else. If you see, when you lose hair and you've got hair loss in multiple places of the body, it's possible that you can have hair loss almost everywhere. What we call alopecia totalis. That means every aspect of your hair has got some kind of loss. You have a bit of scalp hair loss, you don't have brows, your armpits are clean like a baby, you also don't have pubic hair. Most of the time with those kind of things, it's always back to autoimmune because we know antigen-antibody reaction on the hair follicles is internal, which is why it attacks almost everywhere.
Yeah.
Other hair losses like alopecia areata, you just find a patch of hair, a random patch of hair is gone on the side of your hair. Also autoimmune. And that's very common, by the way. It affects a lot of males, yes. Alopecia, you just find a small patch, clean like a coin, like a 5 rand coin. You don't have hair there. That's very common. It's also autoimmune. But with the brow, it's too isolated. And because the brow has a different type of hair compared to your hair, your armpits and your pubic, it's a different type of hair. So that is just genetic. There are people in families where they don't have brows, but they've got huge afros, big afros, and you wonder why. And there are people with huge brows, no lashes. They don't have, like, they've got like tiny small
ones.
That is just genetic. If you look into your family, you will see that a few of you don't have brows. If you look into my family, we all have brows, but very small lashes. So there's nothing wrong with you. It's just the way you are born.
Got you.
Your kids will probably not have brows either,
Please don't
unless
say
their
that.
dad has.
Okay.
And then you're a mix of some sort.
Now I know where to look. Now I know where to
You
look.
must balance.
Exactly.
And about that, you said alopecia areata, where you have patches of. I've seen a child that has that.
It's common in children.
Does it get treated?
It is a better sub-diagnosis than your cicatricial alopecia because it responds very well to steroids, right? Even if it's just topical. You can just put some Dovate on that child for some time. Usually it will improve. Areata is nice because it's just a secluded area. It's like a 5 rand coin area.
Yeah.
You just find it there. And then it's autoimmune as well, but it's localized. So that's why it responds very well to steroids. Steroids, they usually dampen your immune system in general. So it will act on that local area to put down the inflammation, to put down the autoimmune reaction, and actually make the hair grow. And once the hair grows, it literally sustains itself to grow the hair. So I usually say when you've got alopecia areata, the best is to treat it as early as possible. The sooner you see it, don't wait for it to increase in size. The quicker you treat, the quicker
The sooner the better.
Yeah.
And other conditions that might affect, skin conditions that might affect hair, psoriasis?
Psoriasis will affect hair, absolutely. And it's a chronic condition, unfortunately.
So do you have to treat it,
have
or
to
do
treat it
you send it to
I don't treat. So I am a trichologist. I'm an aesthetics. I work with the dermatologist,
Oh,
hand in
okay.
hand. So I don't biopsy anyone. I send that to the dermatologist. And that's important because some of the traction alopecia patients, you think it's just traction alopecia. Then you go ahead and do the transplant and then the patient doesn't respond. And then you realize you actually missed the FFA because you didn't biopsy the patient. So any suspicion you have at all that there could be something else here except, which is where your training comes in, because you need to spot the difference.
Yes,
And you need to pick up those early signs. And that's where our microscopy comes in. There's a small device that we use, the dermoscope. You must check the scalp with the dermoscope first. And you must see if there's any other features of other conditions on that naturally looking traction. You might find that there are features of CCCA there, of scarring. There are features of frontal fibrosis, alopecia. You need to send that patient to a dermatologist to get a diagnosis. So what a dermatologist will do is just take what we call a punch biopsy. They take a small needle, they punch through the skin, they take a core of tissue, usually with subcutaneous, some bit of fat, a hair follicle, and your skin. They send that to the pathologist, who must look under the microscope and decide on the diagnosis. If the diagnosis come back as CCCA or FFA, that patient belongs to the dermatologist. It's not for trichology. So the dermatologist must treat the patient, because those are not for transplant. They are for treatment. And those are patients you will treat for years and years and years. So the same thing with psoriasis, same thing with seborrheic dermatitis, same thing with what we call dandruff in normal. That's tinea capitis, a fungal infection of the scalp.
Oh, yeah.
Yes. So we just call it dandruff because you just see that, white
stuff.
White stuff.
You just, it's dandruff. Some people have severe dandruff. And that's what we call tinea capitis. So it's a fungal infection of the skin. You will not be able to diagnose that kind of thing without a biopsy, or at least to take a scraping of the skin.
I thought dandruff was like natural to everyone.
No, it's not natural to everyone. You can have it and then you wash. It's a fungal infection that can progress or can be severe. It can be mild, and then most of our shampoos have antifungal in them. Your Heads and Shoulders.
Yeah.
It's got an antifungal medication in there. So if you got a bit of a dandruff, you wash it with Head and Shoulders. You're sorted. But there are patients who have advanced tinea in a way that they start having patches of ringworms.
I've seen that.
Right.
Even their hair, you find that
your hair will fall off on those patches, guaranteed. So you have those patches of hair. Sometimes they get scaling, or what we call seborrhea, and then those things can open, can get infected.
And it gets worse
because you can get bacterial infection there, and then
it gets worse because people don't believe in washing their hair. How often should we wash our hair?
At least 3 times a week. I keep saying this, and people are like, 3 times a week I must wash my hair. You should.
You know what the issue is? To be fair, Shabam, I'll speak for my girls. And even the guys that have afros, it's so hard. Maintaining natural hair is the hardest thing in the world. Like, and then you're advised not to hair dry the hair. Allow it to air dry. Now you're busy walking around utapile. Now your skin is drip literally. Your skin is now starting to get itchy. You're waiting for now. Imagine doing all of that 3 times, and after you have to condition it, and all of that, the process. And
can't you do it at night before you sleep?
But it's a lot.
But you bath every day. What is the problem with washing your hair?
The problem is after bathing. I feel like it's a
why are you
convenience
not washing
thing.
it while you're bathing?
It's a conveniency thing again, because after bathing,
it's a laziness thing.
I mean, conveniency is next to laziness.
Because you are under the shower. You might as well pull that shampoo, girl, and start with your
Why don't you bath like me? Like, get under the shower.
Because you have a cheese cob.
No, women in general just don't like washing their hair.
It's just a lot.
Yes, it's a lot because it's not just washing.
Yeah.
When you finish, it must dry up. So you've got a towel up there for hours trying to dry it up. From there, you must condition. From there, you must put oil everywhere, your scalp. It is a lot of
to avoid dryness as well.
Yeah.
But
hair naturally doesn't like anything heavy on it. That's the reason why, to keep healthy hair, you must always keep it free. So because we put a lot of stuff on our hair, it dampens on it. And that's how people say, but my hair doesn't grow. But you take 2 months to wash your hair. And in that whole 2 months, you are just loading it with
Legit.
Gel, with hair food, with spray, with moisturizer, with frizz. Now there's frizz.
Yeah.
Everything is on that hair. And if you just literally touch the hair like this, you can just...
Oil, yeah.
It's thick, like the
thickened. So the health of the hair, they...
Maybe that's when it will even cause skin problems.
Exactly.
That's true.
Because now,
Exactly.
is there 2 months oil on your head?
It's
I
too
mean,
heavy.
months.
Yeah.
It is.
So to answer your question, any other condition of the hair needs further investigation.
I'm so sorry to interject. I'm so propelled to ask this, especially during this time of the year. And it really hurts me. While you're speaking, I just thought of this. And I relate to it greatly because my baby sister has the longest hair in the family.
Yeah.
I'm a bit jealous, so whatever. But she complains about how painful her scalp is.
Yeah.
She literally cries and goes, "It's so painful. Please just don't touch my hair.
Yeah.
No one should touch my hair." And my mom tries to wash it all the time. My mom is, I guess because she only has girls, she's kind of obsessed with taking care of our hair and doing all of that and braiding. What is your advice to every girl mommy or every girl parent or maybe anyone that takes care of their children's hair and they normally braid it, particularly for December time and maybe in general for kids?
Look, kids need to have the simplest hairstyles ever. Simple, the simplest, the better. So try not to complicate the styling either, right? That's number one. Number two, do not leave hair done for too long. The thing of leaving braids for 3 months on children is why children are having alopecia at a young age. And this is why when they turn 18, all of a sudden they've got traction alopecia. It's because when they were 12, they were braided the whole year. No free time whatsoever, no break in between. When does the normal hair growth stages happen? While your hair is tied. Because you must let the hair follow its natural course. And that takes 6 months, by the way, for the hair to grow from the minute it sprouts out to the minute it's fully grown. So if you are going to be braiding your hair the whole year, when are you giving your hair time to grow properly into fully grown, healthy hair? So that's number two. Number three, obviously, the way we were saying, if you take your children to the hair salon, you need to counsel the hairdresser about how they must handle the baby hair. That's the most important thing. And if your children are trained to know what to do with the baby hair from the beginning, they will grow up like that. So literally, even in the adulthood, you will not touch their baby hair. And that's how we're going to preserve this thing, because now it's such a pandemic.
It is.
It is such a problem because almost everyone complains about their hairline.
It's sad.
Almost everyone. And I blame ourselves strictly because we're not following the rules and regulation. And I think people are not aware how fragile hair is. They think hair, because it's not a live thing, it's a dead tissue, it will just grow back. And they are forgetting that it's extremely fragile. And there's a certain point in life where if you completely and continuously take it out, it's not going to grow back. So for children, that is very important. And keep the products as light as possible. There's a reason why there are kids ranges and there are adult ranges. The pharmaceuticals are not crazy to develop a range for kids that is separate from a range for adults. It's because they know the hair is still at the developmental stage there. There are certain products that shouldn't be used by children. There are certain heavy products that are too heavy to use on the kids. So it's important for parents to be aware of those things. If you just keep those going forward, you shouldn't be having a problem with taking care of kids' hair.
Oh, but
And how safe is this relaxing? Because people like to have softer hair that's easy to comb. Yeah, and how safe is it?
So there are different strengths in relaxers, right? So relaxers can come at, even in our earlier teenage years, we used to know there's normal, there's moderate, there's super, right? They will write super.
Yes.
For coarse hair.
I remember vividly.
Right? I think something like the green one. I don't remember what's the name. It used to have super for corset. So that's for the thick hair.
Yeah.
Right? So imagine if your hair is softer and you go and do relaxing.
Ba go betsa ka yona ya suit.
I see a lot of people now
Eish.
in their old age. It's like, I was bent when I was a child.
Oh,
They were trying to relax my hair. And she's got a patch of hair. A patch of scar. I was bent when I was a child. They were trying to relax my hair. I was bent as a child. They were blowing out my hair. So it's a reality. It's a risk to actually chemically treat your hair. What we call chemical treatment. You call it relaxation, but it's actually a chemical that goes into your hair. So if it's too strong for the texture of your hair, you are likely to cause permanent damage, which is irreversible. There's nothing. Once you bend the scalp to a certain degree, obviously bends have got degrees. First degree, second degree, third. You got second and third, you've already deep down below the dermis. You've destroyed the nerves. You've destroyed the blood vessels. True. There's no hair growth that will happen there. How is it going to survive without blood vessels, right? Yeah. Because the bend has got deeper into where the blood vessels are. So if you get bends with, and the thing is, nobody's going to tell you whether this will bend you or not.
No.
And nobody knows anyway.
Actually, nobody knows.
Yeah. Nobody knows if this is safe for me. Nobody has tested this to say you are guaranteed.
So will it be...
You do it and then you don't bend. You're like, oh, nake wa daken laugh.
Yeah.
Right?
Yeah.
You do it, you don't bend. Okay, nake wa soften.
You even become a brand ambassador.
I understand.
Yeah.
That's the only way we know what we were safe, because na shimsha daken lively all my life, so I know I'm safe with daken life. But what if you go barawana daken life? Okay, it's fine, you can do it. Soft and free. Soft and free, you bend.
So will it be advisable to say kids maybe under a certain age should not be using capital?
Yeah,
I'm a strong believer and an advocate for natural hair.
Yeah.
Not because I'm a trichologist and not because I keep natural hair, okay? But because for safety reasons, especially for children. My daughter doesn't. She's never relaxed her hair. Because why? If why do you need to relax your hair?
But the most common worry is that it breaks.
Yeah.
Even when they didn't relax it. Like, I know my daughter has been trying to grow her hair. Then it grows. After 2 weeks or so, then at the back now it's shorter again. You can see that it was breaking. It grows and...
But so, I challenge you to compare two kids. One who has relaxed hair and one that has natural hair, and compare the growth rate of them.
On the next episode of Mind, Body and Legal Matters with Dr. Livu.
Yeah, that is a challenge. I'll put it to anyone. Go and compare the health of the hair of the two kids. You will just see naturally that the kids with natural hair don't struggle
better
at all.
Quality of hair.
They don't.
On that note,
and it's safe, it's cheaper to keep natural hair.
Actually,
you save a lot of money, trust me.
Even though social media says otherwise when it comes to natural hair.
Why does it say so? No, it's because they know that now is the in thing to have natural hair.
Yes.
They're just trying to sell products.
Yeah.
But it is cheaper. You don't need any. I promise you, if there's one thing in my life that I don't spend on, it's my hair.
Is your hair.
Yeah.
Compared to anything else. I literally don't do anything to this hair. If I wash this hair and I just put oil, that's it, I'm done.
I'm burning to ask these questions. Can we get into the Q&A?
Yes.
Yay. So there's a lot of questions that were asked, and I'd like to just give a shout out because I don't like doing this. I don't like skipping questions. So a huge shout out to Tato from Bramfontein, Nomsa. And these are the guys that I unfortunately can't ask their questions, but we see you. We recognize you and thank you so much. Ayanda, Sipa from Rodiport, some didn't leave their places where they stay. Google from Tembisa, Retabile, Musa from Melville, Naledi from Hillbrow, Kamohelo from Four Ways, Sokhofasa from Deep Loof or Deep Sloot. Yes. Shout out to y'all. So I'm just going to skip and just ask some questions. I have one here. And I think you've already covered it, but I'm just going to ask for emphasis purposes. Nomsa from Soweto, can braids and wigs cause permanent hair loss?
Yes, for both.
Both.
Right.
Sheesh. Okay.
Because, well, we've already explained the braids. And I think, let me explain the wigs, because a lot of people have a misconception that wigs are safer because they're not pulling anything.
So true.
But if you're gonna install with glue, first of all, glue is it's a chemical. Let's start there, right? Glue is not supposed to be on your head. They can say, no, it's for hair. It's fine, even if it's for hair. But oxalayo, it's a chemical, right? There's a reason why it needs to stick to the hair and to the thing. There must be some chemicals there. So first of all, it's not healthy to stick anything to your hair. It's not healthy for the hair to stick together, first of all. You mustn't stick your hair together for any reason whatsoever. Besides those two reasons, once the wig is stuck to the glue and to your hair, there is no way you can tell me you will safely remove a wig without bringing your hair up with it. There is no way. It can grow back, yes, granted, but there will be a time where you will yank enough hair for it not to come back.
And it's even bad because it's by where you said we should avoid touching the baby hairs.
And
now you're pulling it out.
The baby hair.
Applying alcohol.
I know a person that used to have wig 24/7 the whole year, had to have a transplant.
And now they're crying. My goodness. Okay. Let's run through all of these ones. Ayanda from Santon. How do I know if I have dandruff or something more serious?
Right. So any itchiness that is out of the norm is a red flag. If you open your hair into parts and you've got redness anywhere, that is a danger sign.
Sheesh.
That is a sign of inflammation already. Your scalp must be brown to cream to whatever color that you are. Any red anyway is a problem. Any patch anyway, any loss of hair that is significant enough for you to pick it up with your naked eye is already a red flag. If you lose hair on the floor or in the shower, that is significant enough for you to worry about while you're washing your hair. That is a red flag already. That's how alopecia areata starts, by falling hair and unprovoked. Your hair will just fall, right? If you've got a family history of hair loss, you are already at a high risk of developing hair loss, right? But if you've got a sore of any sort, pain on the scalp, it's a definite red flag. The scalp is not supposed to be painful. It's got a lot of nerves. So it's not supposed to be activated in any way. So if there's pain, there is some kind of touch on some nerve somewhere. It's highly innervated. So if there's extreme pain, then there's a problem somewhere. Any open wound, which is not caused by anything you remember. You just develop a pimple, or you just develop an open sore. That is a problem. So a scalp is one of the areas which is very easy to detect if there's something going on. Any whiteness, whether it's powder form, whether it's patch form, whether it's scaly form, shouldn't be there. That's an unhealthy skin and unhealthy hair. So any of that, if you see any of that, you need to see.
Red flag.
It's a red flag.
Got you.
To see someone.
Kamohelo from 4 Ways. Do things like rice, water, and rosemary oil really work, or is it just TikTok hype?
Rosemary oil, yes. Any oil, by the way.
Is it?
The hair is a lover of oil. Why? Because oil is very easy to penetrate the skin.
Sure.
Compared to your heavy gels, your heavy hair foods that people like a lot, which is why moisturizer or a spray moisturizer is better than to apply a hair food, because hair food will sit there on the scalp.
That's so true.
It takes so long.
Okay, talking about oil, I've seen castor oil trending.
Yes.
Is it
Black castor oil,
or it can be also be used in?
It's very good. It can be used. A lot of people are actually getting thicker hair while on castor oil.
Okay.
I don't know the scientific behind it. Maybe that's another one that we should investigate. So, but oil in general, they are good. And remember, even the serums that we prescribe, they are oil-based for that reason, because the absorption is better.
It's better.
On the scalp,
All right. There's one here that I think is very important. Why does my natural hair feel dry no matter what I use? And that is me.
That is just your own natural scalp.
Yeah.
You just naturally dry. And those are the kind of people who must use castor oil, because have you seen how thick castor oil is?
You
Yeah.
know, are we talking
I
about
dare you to try it.
is it the same castor oil? Because truly, I
Not
can't.
the one that you drank when you were a baby.
Thank God. Trauma. I cannot stand the
Not
scent.
that one that they forced
was about
you
to
to clean
buy
your
the
tummy
same
with.
one.
Not that one.
Because I did go and I bought the black castor oil. I
Yeah.
forgot the brand,
Yeah.
but now it causes a lot of itch.
Well, can I suggest one? Is that fine?
You
Yes.
can suggest, yeah.
MPL, black castor oil.
So that's so nostalgic.
Yeah,
MPL.
that one.
Yeah.
You can try that.
Okay.
It's very good. It's quite thick.
It is.
So
It's
it's very
extremely
good
thick.
for dry scalp.
Yeah.
Yeah.
All right. Kia Betsui from Brixton. Are viral hacks or hair hacks safe, or should we be careful?
Well, none of the hacks are safe anywhere or for anything, not even for hair only.
Yeah.
And I know a lot of things are trending. YouTube has got 1 million of hacks of your hair. I mean, obviously, you must be careful in general of the things that. And please, can we use our common sense sometimes?
Yeah.
Right?
Yeah.
Don't just fall for anything and just try. Something you just know this is dangerous for my hair. Some things you just know this is dangerous for my health. Not even for my hair only, but
The skin
this can
on it.
hurt me in some way. And I mean, Google is there. Do your homework, do your research, check out some of these things. And if you've got a doctor next to you, even more,
Just go there.
Just go and consult. Get your
And see a
dermatologist.
A trichologist
Come to me.
Yeah.
once
Go
a
to
year
Dr.
or
Libu.
so.
Come,
Yeah,
actually.
I mean,
Come to me. But there's very few trichologists, by the way, in the country. I'm one of them.
I won't even
But
lie. Yeah.
dermatology, they do hair, they do skin. So if you can't find a trichologist, get to a dermatologist.
And I said this first time, the first recording, and now I didn't because I know a trichologist. darling. But when we first met you, I was like, first of all, I've never heard of the term trichologist ever.
Yeah, it's
It's
very
so
I don't know.
rare.
It's
you know?
specialized.
Believe you me, I work in the hospital. I never met.
Maraugazi. Okay. Tiama from Parktown. Do medication or contraceptives affect hair?
Absolutely.
Yeah.
Especially contraceptive. I think we touched this last time.
Yes.
When we were talking about those that are androgenic, which are more hair growth prone.
Yeah.
So you can grow your hair by being on anti-androgen. Because why? You are dropping down the testosterone. Remember, testosterone women also have, in case you didn't know. Yes.
Testosterone.
Some women have some testosterone.
Is it?
Yes. Some women, which is why some of them look more male looking than feminine. And that's why women in sports, you'll find that they say, no, your testosterone is too high. You cannot compete with other women. Right?
That's where it's coming
That's
from.
where it's coming from. So, which is why an anti-androgen contraceptive is good for hair growth. And actually, we do prescribe some of these contraceptives for women that appear with male type.
Got you.
Baldness.
Yeah.
We'll put you on contraceptive because we know it's going to drop some of these hormones down and actually allow the hair to grow. So yes, definitely.
Last but certainly not least, and again, thank you so much for those that asked these questions. Although I couldn't ask all of them, you can leave some on our comment section, and I'm sure we'll be able to ask Dr. Lebu to check
When we
them out.
visit.
When you come to my
Yes.
Oh yeah, by the way, Lumkile, you're dropping all the surprises now. We'll emphasize. Anyway, Imani from Fordsburg asks, and since you're a gym fanatic, Dr. Lebu, does gym sweat affect hair or the scalp, positive or negatively?
Well, negatively because of the heaviness on the hair. Which is
Is
why
it?
I advise people who are active in the gym to wash their hair. Which is why we've got showers in the gym.
Oh yeah, fact.
Not necessarily to wash you, but to also wash it. That's why they've got dryers there. Why do you think they put dryers there? They know you must wash your hair as
For
well.
vibes.
No, not for vibes. So I'm an advocate of washing hair 3 times a week. So obviously, for me, anything that's heavy on the hair is a total no. Whether it's sweat, whether it's products, whether it's anything. First of all, I don't like people wearing hats the whole day on their hair.
Hey, Mara, now you're coming for me, eh?
I'm
I have
coming
a
for
cap
you.
on.
Right. You can wear the cap, but at some point, you must look, you need vitamin D. You like it or
For
not.
sure.
Everywhere.
Yes.
From your scalp to your toe.
Yeah.
So if you're forever going to be having your sporty every day.
It's bad.
When is vitamin D getting into your scalp?
Yeah.
To do what it's supposed to do. To activate whatever it's supposed to activate and give you nice skin and all that. So
Got you.
anything heavy on the hair, it's a no. Whether it's sweating, it's your everyday wig that you wear daily.
Hey.
No. Sometimes just leave the wig out.
That's true.
And just comb your hair.
That's true.
Sometimes the whole weekend, just leave that wig and make sure your hair is healthy and out there. So yes.
Just a quick one. I have braids. I go to the gym. Can I still wash my hair?
With the braids
Yeah.
on, yes.
I
You
can.
should actually, because that way you don't have to take out your braids. Yeah.
Okay, we're about to
And
wrap it
people
up.
don't
Any
like
last
that. And you
remarks?
know, we used to do that when we were young.
Is
We used
it?
we used to wash our hair with the braids. We'll go to the salon, they will wash, and then that's it. And braids used to last longer.
It's not a thing anymore. eh?
Yeah,
Yeah,
it's not
it's not.
Now we
Any
want to
last
change.
remarks?
Okay, I think we are out of time now.
Yeah,
but,
now it's time.
But you know what? Last time we talked about
We need to wrap it up.
supplements.
Yeah.
Oh,
Those IV supplements that we do.
yes.
Yeah.
How good are they for the hair?
Not necessarily for the hair. The supplements that are good for hair are not IV. They are oral. Your biotin, your zinc, your vitamin A, those kind of things. Those are supplements that you can take as tablets. IV, it's for skin.
Oh, it's mainly for
It's
skin.
mainly for skin, not for hair. I am yet to find an IV treatment for hair.
Oh.
I'll do my research though. But so far, no.
Okay.
You must just take those oral.
And at your clinic, do you do
The
the...
IVs, yes, for skin we do. Usually those that are glutathione based, also vitamin C, zinc, and all that. So it's usually a cocktail of things that we mix in one drip, depending on what is it that we're trying to achieve on the skin. So they differ.
Okay, and I think we
now it's
out
fine
of time.
now. Yeah.
But
Well,
just to say,
yeah.
Samkelo, if you can just put the doctor's number. So I'm sure
Samkelo is
people
our
will want
producer,
to-
by the way.
Yeah.
Yeah. Just add Dr. Libu's contacts. They should be appearing now at the bottom or top left. That's it, right there. Very good. All right. Just like that, we wrap it up. Another episode, and I cannot wait. For you
visit
to
the
watch
clinic.
this. And also, that's a surprise that I was meaning to say. We are, maybe after some episodes or early next year, we're going to be going to Dr. Leva's practice and we are going to be seeing this phenomenal woman in action and learn a thing or two,
Yeah.
you know.
Can I just add, because
Sure.
it's a new practice, maybe I must just put it out there. So we recently got a new building where we are moving.
Good things are happening.
Hey.
yeah?
Yes, God has been working. So
The economy is going yeah.
So a lot of people, when I moved here in January, they were saying, "But why don't you have other people that you work with, like other doctors, and make it like a center where we can come and get all the services?" And for a long time, I've been toying around with that idea, and I'm like, you know what? Maybe it's time that I actually went a bit further and just expand the medical field. So it's an all-inclusive medical center.
Beautiful.
General practitioner is there, dentist is there, psychologist is there, dietitian is there. Myself, I'll be doing the skin clinic and the transplant. Then we've got a separate weight loss clinic, which is a collaboration between myself, the general practitioner, and the dietitian. Remember, weight
Washa?
loss is a multidisciplinary
Yeah.
thing. There's Bomonjaro,
Yes.
that needs to be prescribed. That's where the GP comes in, right? There's lipolysis injections that needs to be given. There's a diet. You need a diet plan of some sort. So the dietitian needs to take you through on what food you must eat, what you must not eat on your journey to weight loss. And then finally, we've got the renal dialysis center. If you've had a patient or you know a family member that had kidney failure, you will know how important renal dialysis is. That is the life and death of a patient with renal dialysis.
Yeah.
So, and Lumka was saying he's a nurse, so he will know this for sure.
Exactly.
You can never have enough renal dialysis centers because there's so many people now that are in kidney failure, especially because of diabetes, especially because of hypertension and HIV. So we're seeing a lot of patients. So I've got a technician that will be in the house and will be giving those services.
And
so
you said you are
support us in
Centurion and Polokwane, I think.
yeah, and Venda in Polokwane. So Centurion, we are just after Blue Valley Mall. If you just pass Blue Valley, if you go now, there's already a signboard there.
Okay.
Shows
This
that
girl is on fire, fire, fire. Love it for you.
From Venda to the
Love
world.
it, oh man, love it for every human being. And I'm absolutely happy, and I'm really getting excited. So I can't wait for us to delve into yet another episode where we continue this conversation and get into cutting edge, most trending topics, especially about weight loss. But anyway,
we should talk about
we
that,
definitely
Monjaro.
should. Definitely.
We should get maybe one of the listeners who or viewers who's interested in hair transplant January or Feb. So maybe we can come when you're doing.
We'll see.
You should
We'll see.
actually come and see when we are doing it.
Yeah. We'll definitely see how we
follow
work
the whole
everything
thing
out.
from the minute the patient comes in until we're done.
Definitely.
That will be very interesting.
That will be.
So expect us very soon.
Yeah.
All right. A huge thank you goes to you, our beautiful
Thank you, Zabi,
trichologist,
for
for giving us another chance and for coming and giving us all the nuggets. Oh, thank you so much. But if this episode told you something new about your scalp, your hairline, or even a normal wash day routine, don't be shy. Share this with someone that you know needs the advice. Until next time, stay kind. Bye.